So I'm here with Dr. Pompa from New York.
Yes, I am.
Welcome to JDIQ 2023.
It's a pleasure to be here. It's my first time in Montreal, and I'm loving your city.
Really?
Yes.
And how do you like the participants?
Oh, absolutely fantastic. Some of the best participants I've had in the whole world.
Really?
Yes.
It's true. It's not like rock stars.
No, I'm just saying this. In fact, I taught at NYU people from all over the world, and French-speaking people have always asked me the best questions. That's true. I'm not just saying that. I don't say that wherever I go.
Wow. I have a few questions for you today. Is there any particular event that sparked your love of teaching that particular subject?
Many. So while I was in practice for 30 years in New York City, I had many examples of medical emergencies that occurred with friends of mine where they called me on the phone to ask me what to do. And telling them what to do was very rewarding. Also, in giving this lecture while I was in practice for 30 years, I made certain recommendations to people, one of which was to get a pulse oximeter, which in your country is standard, in my country is not. The number of people that listen to me, 15%. So one of the 15% bought a pulse oximeter on his way home from the lecture, put it on him, and realized his pulse was 29. He thought it was a defective pulse oximeter. So the next time he went to his office, he asked the first patient who he treated, who happened to be an EMT, that's a paramedic emergency technician person, to take his pulse. The person took his pulse, and it was 29. So the paramedic said to the dentist, I think you should go to the hospital. He went to the hospital as an emergency and had an emergency pacemaker put in on the spot. And they said that he could have died had he not done that. So that was many years ago that happened. And since then, I've known people should go to lectures on this topic because they could not only save another person's life, they could save their own lives as well.
Oh
So
my
that's
gosh.
one reason. Many others.
Wow. And what's the second
The
one?
best part about that is when he came home, he invited me to go to a great dinner in Manhattan on him, which was at Estratoria Milos, the best Greek restaurant in New York City. So I got a
Milos,
free
yeah.
meal for the life.
Oh, yeah, but I think that gratitude of saving a life is even better than
Saving a life is the best, highest reward you could get in life. There's nothing higher.
Totally agree. Second question, what type of emergency or event are teams least prepared for?
Okay, the one that they're least prepared for is the one that they don't rehearse and practice for. So part of the problem with this whole scenario is that people don't practice mock emergencies enough. In my lecture, I teach that it's a time to do it that is given to you. And the time to do that is given to you is when you have a cancellation. So when the patients don't show up for a visit and there's a half an hour or an hour in the practice in the schedule, that's when they should be practicing a emergency. Why? Because you don't schedule emergencies and you don't schedule cancellations. So when they practice the emergencies, they're better prepared for it. When they don't practice, all emergencies are not handled well. The one that's most common now that's becoming more evident is people that suffer from hypoglycemia. Their blood sugars go low, and the dentist isn't sure exactly what to do. So, and even if they go unconscious, that could be a very dangerous situation. And now there are drugs that could be used to prevent that, which many are not aware of. So come to my course and you'll learn those drugs.
I have a question for you. When you say practice the emergency, should they practice like physically or just rehearse in their head?
Physically, yes, yeah. They're called mock emergencies. And you do a scenario in your office that's all fake, but it's pretend that it's a real situation. And in doing that in your office, you see the people that are very helpful to you and people that may not be so helpful to you. And it's the best way to prepare for an emergency is to practice them before they occur.
Okay, thank you. What kind of emergency you experienced yourself, but you never thought would have happened before?
Oh, there's one emergency that happened to me many years ago that's an incredible story. So it was 1978. I know many of you were not alive. In 1978, you were, okay. And I was driving a friend. Actually, I'm sorry. I was in the passenger seat, and my friend was driving in the driver's seat. And we were on a highway at 6:30 in the morning because we were going to play golf. And on our way to the golf course, we got on the highway, and a car was approaching us straight on and going to come right into our car, and we would be dead. And the person who was driving, my friend, who was also a dentist, was changing the station. So there were push buttons in the cars at that time. So he was pushing this, and so he didn't see the car coming. So I'm in the passenger seat, and I took the wheel right out of his hand, and we rolled over to the side, and the car missed us by inches, and the car went like this. And I didn't see this man again, the driver, for like 30 years. He gave a lecture at my school, and because something that happened to him that was very unusual. And during the lecture, he says, "Dan, I want to thank you for saving my life." And I said, "I have to tell you, at that very moment, I wasn't thinking of your life. I was thinking of my life." So he said, "Yes, but if you didn't do what you did, my son wouldn't have been born." And I said, "You're right. You see, what I didn't tell you is the man who was driving's last name. His last name is Zuckerberg, because his son is Mark Zuckerberg."
No way.
So Ed says to me, "Danny, if it wasn't for you, there'd be no Facebook." And I said, "Thank you very much."
Come on, you're serious?
100%.
So my last question, what medical problems are most forgotten in standard medical history forms?
Good question. Very good question, because it is a big problem. So most medical people, and in physicians' offices as well, will always ask, has there been a change since we've seen you last in your insurance or in your address? But they don't ask, has there been a change in your medical history, which is something that should be done for every visit. Even if you're seen on Monday for the consult and your treatment is on Tuesday, they should say, has there been a change in your medical history since we've seen you last? Refresh is the word. Every medical history should be refreshed to be up to date every time the patient comes to your offices. Things that are not asked is a simple question like, do you drive? Because a diabetic patient who's not controlled does not drive. An epileptic patient that has got seizures that occur does not drive. But it's the last thing they tell you, because they think that if they tell you these things, the dentist won't treat them. So you have to fish, you have to delve into their background and history. But refreshing and updating the history is probably the most important thing. People also don't often ask in dental histories about pulmonary embolism, which is a problem. Hyperventilation is a symptom of this, which dentists can mistake to mean the person is nervous, but it's actually a sign of a pulmonary embolism. So things like that should be more noted. But refresh is the main thing.
Thank you so much for being here at JDIQ 2023. Hopefully we're going to see you again.
I hope so. I'll be presenting in the afternoon.
Great. Thank you so much.
You're welcome.